Hi there, my name is Dr. Virginia von Schaefer. I wanted to share some thoughts I have about breast cancer and hormonal replacement therapy and what are the real root causes. A long time ago, when I was still working as an operating surgeon, I came to Orange County, and I was pretty much blown away with the number of breast cancer cases that were coming to medical attention and requiring surgery. Honestly, I'd never seen so many people with breast cancer ever. And I even saw things like inflammatory breast cancer, which is considered quite rare, in really young people here in Orange County. And I remember to this day, I was in the operating room assisting another surgeon because it requires several sets of hands to do total mastectomy surgery. And I made the quip, there must be something in the water here that causes breast cancer. And I kind of said it as a joke. But at that time, I didn't really realize until, many years later, when I was studying environmental risks and patterns of incidence of cancer more closely, that I realized that, yes, Orange County in Southern California has one of the highest rates of breast cancer in the entire nation. And it is only seconded by another area in Northern California, in Marin County, where there are a lot of vineyards. Well, it turns out that the implication here, and the fact that remains, is that a tremendous amount of pesticides were used to keep orange groves clear and be able to grow all these nice, big, juicy oranges. So DDT, which is one of those pesticides, is non-biodegradable in the water table for about 150 years. And those same kinds of pesticides have been historically used in the vineyards in Northern California, as well as orchards in Washington and Oregon. And so all of these areas up and down the coast have very, very high incidences of cancers. Why? All these chemicals that we use, hopefully to reduce pests and things, actually get stored in the water table. They're non-biodegradable. And when we take a shower or drink water, these chemicals are in that source. We absorb them into our bodies, whether we're showering or drinking the water. And what happens to those chemicals is that our bodies will attempt to detoxify them, but turn them into hormone-like substances. So we call those chemicals or compounds zeno-hormones. So in the case of estrogen, a zeno-hormone is a compound that is enough like estrogen to lock onto the receptor side of a cell. However, it can't turn it on to do what it's supposed to do. So if you have an ever-increasing titer of non-biodegradable kind of dummy hormones and a decreasing amount of normal hormones, there's no way that a normal hormone can compete for a receptor site with a dummy hormone. And hence, actually, root causes of breast cancer can rest in part, not entirely, but in part, in hormone insufficiency, effectively speaking. So it's kind of like when you go to the hardware store and you want to make a key, and the guy dutifully cuts it, you take it home, it goes into the lock, but you can't turn the key because one little glitch isn't not quite right. So you have to take it back and have it redone. Well, this is exactly how xenohormones operate, and how they prevent function from occurring, because there's too many xenohormones and not enough normal hormones. Another condition that can contribute to this is even the rampant use of oral contraceptive pills, which also help to reduce normal functional hormones. So if you use oral contraceptive pills and you grow up and live in an area where it's heavily laden with pesticides in the water table, that's going to increase your chances of getting breast cancer as well. So the epidemic that we have and what we're experiencing in breast cancer in women isn't really caused by simple use of bioidentical hormones in a menopausal or perimenopausal setting. It dates way farther back in the entire life of the person and exposure to chemicals and pesticides. Just something to think about, because many women come to me and they say, well, I started on hormone replacement and then 3 months later I got breast cancer. So my doctor took me off of everything and said I caused my breast cancer by taking hormonal replacement. Not so. Although when people are diagnosed with breast cancer, they are recommended to stop any kind of hormonal therapy. It isn't really the major causative factor in most cases. Yes, there's the rare person who, overdoes, but the majority of people are suffering from hormone insufficiency due to the presence of xeno-hormones in their environment. Thank you.